This peel is truly sort of a misnomer when we call it a peel. This is a wonderful enzyme treatment, and within my own cosmetic dermatology practice, I'll often frame it as just that. I don't always use the word peel for patients in discussing this treatment as an option. This is a treatment that, as you probably know, contains 2 enzymes derived from pineapple and papaya. It also contains a very strong antioxidant in a form of parsley, and then lastly, it has that wonderful peptide that we're using, the sea algae extract, that we also use in our real blockbuster new product, the sea stem, that's also found in this blue Tidal enzyme treatment. And basically, the indications for this would be for skin hydration. It is a tremendous skin hydrator with immediate results of patients after the peel really feeling a velvety texture to their skin. When we use the moisture meter, we see that after a single peel, the skin hydration level is up by about 50%. So this is fantastic for skin hydration. Probably secondary to the dramatic increase in skin hydration, we see a skin tightening and firming effect. Many of the people who have this treatment upon wash off will say that they feel almost an immediate skin tightening on their face, and by the way, that does last for at least several hours to the day of treatment. The other things that you'll see is that this is a very safe peel to use, as we have in our selected patient here, on patients who have a little bit of facial redness, because again, we're not using any acid within this treatment. It's also very good for people who are sun worshipers. So it's a wonderful wintertime treatment because of skin hydration. It's a wonderful summertime treatment because when you have patients who are boaters or beachgoers, this is very safe to use. So we're going to start, and the first thing I'm going to say to you is that we're going to be pretty much following protocol. And do remember that every time that you order a CosMedical peel product, you are always sent with each bottle the protocol for that peel treatment. Also remember that we have our new and updated training manual available to you. This is well over a 100-page document that reviews everything, all of the products we make, all of the ingredients, protocols, and it lists every peel protocol on a separate sheet, both indications as well as protocol. Also, you will find a patient consent form if you do like to have consent forms within your practice, and skin evaluation form, because frankly, we do need to evaluate the patient's skin before deciding which peel or enzyme treatment we may be offering them. So the blue Tidal enzyme peel or treatment is named as such because we've got, it's a blue color. It also has a very nice scent of the pineapple, which is in the product. And basically, as with all of our peels, we're going to start by making sure that there's no makeup on the person. So we're just taking, in this case, a little bit of makeup remover on a 4x4, or you could use a 2x2, and we're going to be wiping down the face. This patient has told me that she doesn't have makeup on, but it's always a good idea to see, and you can see that there's absolutely nothing on this gauze, so we know that this is really a fresh face to which the treatment can be applied. When we talk about our most aggressive peel, the Rejuva peel, you will see that we're going to be prepping the face with some alcohol. In this case, where we're going to be specifically choosing this treatment for the more sensitive skin, the person who needs more hydration, we really don't want to do the traditional degreasing with alcohol or acetone. It would really be very much against the purposes of this treatment. So next, as with all of our peels, we're going to start to apply it. You will notice that I'm wearing vinyl gloves, which I greatly recommend. I think more and more people are, sensitive to the fact that they'd like us to be using vinyl gloves. Now, I'm using a little paintbrush applicator. Actually, this was written up years ago by Dr. Martin Zayak in, I think it was derm surgery. The use of this paintbrush applicator just gives you a very uniform application. and it's a little bit faster, and these are disposable, which is nice because when we use instead of fan brush, we have to think about, you know, really cleansing it and all of this. So as the protocol says, we always suggest starting on the forehead and then coming down the lateral face. And the indication here again is for increase in hydration, skin firming effect. This is someone who has some facial redness and a history of sensitive skin. So we're going to go last of all into the mid face where she has a little more of her redness. Now in some patients who really have some under eye puffiness, you can take the peel and sort of pull down on the skin just a little and put the a little extra of this treatment in that area of under eye puffiness. Frankly, there is not all that much noticeable under eye puffiness, but I like to show that also. Now, as far as for how long you'll keep the peel on, we don't recommend keeping it on for more than 5 minutes. Possibly in subsequent treatments you might get up to 6 or 7, but we're going to start in this particular case leaving it on just about 3 minutes. So what we want to always be sure of is ascertain that the patient is comfortable. And Deb, are you comfortable? Mm-hmm. Great. What would you say, Deb? Are you feeling any sensation at all with this on you?
No.
Okay. So we basically, I'm wondering if I can just have a timer. I'm wearing a watch that doesn't have the second hand. So when we get to the 3-minute mark, we're going to start some wash off. And typically the patient won't feel any kind of a sensation except for sometimes in the most sensitive skin people who have described to me that they're sort of aware that this is on them. Some people who are very thin-skinned in an older population, if you had a woman, let's say in her late 60s or 70s, because you do really get an amazing increase in skin hydration, you know, you're trapping in a lot of moisture. In some of the patients, they almost do have a little sense of feeling a little sense of a lifting of their face. I would say that in our patient here, that is not going to be the case. This is more of really sort of a preventative treatment. It's a way to maintain patients who have rosacea, who have sensitive skin, who have a known photosensitivity. And so we may have just dropped, so this is, again, the indications for this are going to be people who are possibly dehydrated. This is wonderful during the winter months. Again, people who have sun sensitivity or a very outdoor lifestyle. This is non-photosensitizing, so this is a wonderful indication for that kind of patient. This is going to be very good for patients who have rosacea. For even I've done it on patients who have DLE, discoid lupus. We really didn't have very many alternatives for patients like that before. And I will mention to you that because this is a very mild treatment, remember I like to use the word treatment actually instead of peel even, I, in my own practice, do repeat this every 1 to 2 weeks. I do charge typically a fee for doing a series of peels. I think that the fee that you charge will be very much dependent on the area within which you practice. We see a range of anywhere from $60 per peel if you purchase the series up to $110. We're often asked if the CosMedical peels can be used in conjunction with treatments such as microdermabrasion, anything like this. And this is really the one and only other peels that we do recommend can be used pretty safely with equipment. That could even include steaming, but I would not do that. I think a very good best practice for us all is the first time we do this treatment to do it without any equipment. And then on the subsequent, you can use some equipment. And again, this would be the one where you would think about using equipment. So we're just about at the 3-minute mark. And what I like to do is just to have some water-soaked gauze to start to remove this. Since there's no neutralization here, we don't expect that the patient will experience anything. When we go on to our other peels that are acid-based, and all of the Pro Peel series, we're going to see that often the patient does feel a little bit of a reaction when we start to neutralize with water. But in this case, typically, Deb, do you feel anything as I'm removing this?
No, just cool.
Cool, right. And so this is, I'll mention, this is not cold water. This is tepid water. I think if you use really cold water, you may not get the, the peel treatment removed well enough. I think you can see that some of the blue is coming off, and at the onset I had recommended not to leave this peel on more than a total, as you go through your series, of 7 minutes. We have had a report of someone who left it on for 10 minutes and then actually had a little bit of a difficult time getting the food coloring off from the peel, because that's what we're using, a little bit of blue food coloring to make it into what we believe is a little more pleasant experience with the blue Tidal name to it. So it's important to be sure to wash everything off. What the person will often feel if you ask them to run their finger over their skin, which I'm going to ask Deb to do in just a minute, is that they'll often feel sort of a little bit more of a velvety texture, especially if you're doing this in winter months when skin does tend to be really much more dehydrated. So Deb, I'm going to ask you, can you feel a change at all?
Yes, it's nice and soft and silky smooth right through here.
Yes, it does. That silky smooth is a very common term that you'll hear used. So now that we've rinsed everything off, we did ask Deb if she felt the smoothness, and she did ascertain, yes, she felt that silky smoothness. Now we're going to, I often like to do that before I do the vitamin C hydrating spray, which I'm going to do now, the vitamin C peptide spray. I do like to instruct patients not to put on mascara if they're coming in for these peels, because otherwise you can have little black streams of mascara coming down. Once we've done this, I do like to apply a little bit of VitaSoothe. And the VitaSoothe is just going to really help to trap in the increased retained hydration after the peel. So this is a sealing serum. It's going to be sealing in the moisture. And also do remember that our VitaSoothe is really a very unique product in the marketplace because it has in it our special form of gamma-tocopherol, which is the strongest antioxidant on the market, not only in really quenching oxygen-free radicals, but it uniquely also quenches nitrogen-free radicals. So we feel very strongly that whenever you're doing any of these procedures, except for Rejuva Peel, where you're going to leave the face sort of naked once the peel's gone on, but for any of our other 4 peel products, we do like you to seal the face with VitaSoothe before the person walks out. It may be a little bit of a rainy day here today in South Florida, and so we wouldn't necessarily, first of all, with the blue Tidal, it isn't absolutely necessary to put on the daily replenishing, but we may just put on a little bit to show you. Many women, especially, sort of like a little finish on their face after they've had these treatments, and so we're going to be just massaging in the daily replenishing. I do know that many of our skincare specialists do not keep their gloves on when they're doing this massage, and I think that that's just really totally up to you when you're massaging in that final layer. But we're just really working to give her a little nicer finish on her skin, and I think I myself am actually going to take off my my glove, because what I want to do is there's just a little bit of increased redness in the malar area here, and so what I'm doing is just putting a little more of the replenishing. Remember, this is our totally chemical-free SPF 30 that also has the anti-wrinkle peptides the antioxidants in it as well. And we're just putting this on as the finish, because I do suggest to you that with all of these treatments, the very final thing will be to have the person take a look in the mirror. So Deb, we're going to ask you to open your eyes and see that you're happy.
It's nice.
Right. Yes, we really want the person to feel, you know, really sort of ready to go out. And in the case of the Blue Tidal, if she needed to even go and do a television spot, she is very camera ready immediately after the Blue Tidal enzyme. So thank you very much, Dan.